is now 19 minutes past 7. Thank you for staying with us. Cases of hypertension continue to increase and many lose their lives due to this condition. This morning we have invited surgeon and former Deputy Minister of Health, Dr. Edwin Muguti, to shed more light on this disease. Welcome you to Good Mornings, Baba Dr. Muguti.
Good morning. Thank you very much for inviting me.
So what is hypertension?
Hypertension is high blood pressure. In other words, blood pressure which is above what is normal for one's age and gender. Because blood pressure differs in children, in young adults, in elderly people. You have different levels. So for one to be diagnosed with high blood pressure, your blood pressure should be measured and is found to be above the normal range for your age group, your gender. Yeah.
So you're saying that it also it affects hypertension, affects children?
It can,
as
but
well
it's very rare in children. Yeah. Blood pressure tends to increase naturally as one grows older.
Okay.
Yeah. So as one grows older, the blood pressure has a natural tendency to increase. That is normal. That's why the question of blood pressure for age and gender comes into play.
But when it affects children, what would have happened?
If they have special conditions, like there are some cancers which can cause high blood pressure, like if somebody has a pheochromocytoma which produces excessive adrenaline, they can actually cause high blood pressure in children.
Oh, so that's why
kidney disease.
So that's how hypertension develops when they have got all those.
Yeah, there are two types of hypertension or high blood pressure. There's what we call essential hypertension, where there is no immediately identifiable cause. The cause is multifactorial, genetic causes, dietary, so you cannot quite pinpoint the cause of the condition. Then you have what we call secondary hypertension, whereby there is an identifiable cause, which if you remove the cause, the blood pressure becomes normal. So cases of special cancers like pheochromocytoma or Cushing syndrome can present with high blood pressure if you treat the underlying condition. You can also have high blood pressure in pregnancy, associated with pregnancy, which can actually be quite dangerous and can result in loss of the pregnancy, can even kill the mother. So it's very important people to have their blood pressure monitored regularly, especially as you grow older.
Okay. And how is it diagnosed?
It's very simple. One presents themselves to the clinic or to a doctor, and there are special measuring machines which call sphygmomanometers, which is attached to the arm, and most health workers, right down from the neck upwards, are able to measure blood pressure, and they can check if it's found to be high. Normally we ask the patient to come back for at least 3 readings. If it's consistently high, then one is considered to have high blood pressure. Then we should then investigate to see whether there's any reversible cause, which we then treat. If there's no reversible cause, we put the patient on treatment with medical drugs, exercise, and the dietary manipulation. Okay.
Is it possible that one can have hypertension and not realize the symptoms?
Oh yeah, we call it the silent killer, because there's actually, in most cases, there's no symptoms. You feel okay. So it can only be diagnosed through examination. Yes. Yeah, so it's important to have regular examination.
Okay. So what are the treatment options?
Treatment options range from lifestyle management, which includes regular exercise, paying attention to your diet. One shouldn't consume too much salt. So the salt consumption, the ordinary table salt, should be limited. Yes, minimal. Also avoiding too much animal fats. Kuchanyama too much, coach too much, all those things. Yeah. So that can actually result in the blood pressure normalizing in a significant number, a proportion of people. It's only those where the blood pressure fails to be controlled through these lifestyle management issues, whereby we then have to put the patient on medical drugs. And there are different types of drugs that one can take. Over the years, we've evolved from a situation where one would have to take a drug for 3-4 times a day. Now most patients can take 1 drug or 2 once a day, which is more manageable. Yeah.
But hypertension or high blood pressure can lead to diabetes, or it's related somehow?
It's somehow
Because most of the
closely
people that
related.
yeah.
A lot of people have high blood pressure and
Also
diabetes
have diabetes.
concurrently. And it's not yet known exactly why, whether it's in their genetic makeup or what, we don't know. But they tend to go hand in hand. And also they tend to cause similar complications. So it's very common for one to have both high blood pressure and diabetes, and they both have to be managed concurrently.
Well, thank you so much for coming to Good Morning Zimbabwe. Former Deputy Minister of Health is also a surgeon, Dr. Adrian Muguti. He was talking to us a lot today, enlightening us on hypertension, which cases of which continue to increase in Zimbabwe. And many people are losing their lives due to this condition. Join us shortly after the break for more. Do stay with us.